Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Dennis Mullins. Dennis, why don't you tell us about, where you started out with, the pain in shoulder, and then you went to the doctor, and kind of take it from there.
Well, I had a pain in my shoulder, so I went to my family doctor, and they sent me for an MRI, and I took the MRI results back to them. And by the time I got home, they was on the phone, telling me to come back down there. They was going to put a neck brace on me, and I was going to go talk to a surgeon. I went and talked to the surgeon. I wasn't too fond of what he had to say, because he wanted to go in through the front and the back, take out 3 discs, and fuse 4 vertebrae. So I went and talked to a chiropractor I know. He looked at the MRIs, and he didn't have the equipment, and he said he couldn't touch it. He sent me to another chiropractor who had the equipment, and he looked at the MRI, and he says, he wasn't going to touch it either. So I went and talked to another surgeon who, he just wanted to go in through the front and take the discs out and fuse the vertebrae. Then I talked to a buddy of mine who told me about Dr. Roadhouse, so I come and talked to him and decided that was the best option that I had, because I'm not fond of getting cut on, because I've seen too many people that's been cut on and they was crippled up for the rest of their life. And so Dr. Roadhouse started working on my neck, and I got my range of motion back, no pain, and everything's going great.
Yeah, and that was, obviously you had 2 surgeons that were going to do the same thing, maybe a little different, but they were ultimately going to fuse your neck. And, that's what Herb says is, we like the challenge of the tough cases. And you remember when we came in, your balance had been off and you're unsteady on your feet, and you really didn't know what that was. And we did the cerebellum testing on you, found out the cerebellum wasn't firing properly, so we got you on the oxygen, started doing, the neurological treatments, because if we're going to do decompression, cerebellum has to be functioning properly because of those. You remember how tight your neck used to be.
Right.
And so we did that along with the decompression, and you've just been doing fantastic. Now we're to the point where we're working on the ATM2 to strengthen, and you've really got a lot more range of motion back with that, because when you first came in, you couldn't move hard, and you had that collar on too, but
right.
You had hardly any range of motion in any plane. Was there one movement that you could do that, you still had pretty good movement in?
Now, as far as I can remember.
Yeah, I don't remember any of them.
No.
But anyway, so we're almost done with them. The pain in the shoulder's gone. He's getting his range of motion back. He's strengthening. He's more steady on his feet and doing really good. We still got a ways to go, to strengthen it and get all the neck rehab so it stays solid.
Right, but we're getting there.
Yeah, we're doing good. Okay, well, I know that this wasn't covered by insurance, and it was expensive, but you're pretty happy with the results so far?
I'm very happy.
Okay, good. All right, well, thanks, Dennis, and we'll look forward to getting you all fixed up, okay?
We're going to do it.
Okay.